Okay, hello. My name is Dennis Speed, and we are here for the fireside chat with Lyndon LaRouche for the LaRouche Organization for Thursday, May 13th. What we're going to do is start right off with a statement that was written, which will be introduced by Paul Gallagher, who's also giving the primary briefing for the night. Following Paul going through the statement, I'll have a couple of remarks, and we'll go back to him for the primary presentation. So, Paul?
Okay. We need to start by making this clear to people because this is important. Helga Tepp-LaRouche is releasing today a statement that is it's started to go through the process of being distributed, a statement for of policy for the Global Health Summit, which the World Health Organization is holding in Rome 1 week from tomorrow, May 21st. The release of this statement by Helga is dated May 14th. That's tomorrow. And it is something that she has repeatedly talked about, but here we have a turning point of the what is supposed to be the major multinational public health organization in the world, holding a conference in the middle of the still surging COVID-19 pandemic, and here we are in 2021. This summit has itself just released a statement which is completely inadequate. I'll come back to that in a minute. But here is Helga's statement. Global health requires medical infrastructure in every country. Major industrial nations must collaborate now. And she begins by saying that the only way the prolonged, and it is now very prolonged, COVID-19 pandemic can be stopped is by rethinking the solution. There must be a modern healthcare system in every country, and since in the vast majority of countries in the world, that modern healthcare system, by the standards set out already 70 years ago in United States legislation, that public healthcare system doesn't exist in the vast majority of countries in the world. Therefore, the infrastructure for public health has to be built somehow, and for medical care delivery at modern standards, somehow in every country, with the lead taken by the major collaborating powers. One model for this, she says, is the United States Hill-Burton Act, known as the Hospital Survey and Construction Act of 1946, which stated at that time that 4.5 hospital beds per 1,000 residents of each county should be provided at the earliest possible point by that county with the assistance as necessary of the federal government. And this, in fact, led to, by 1968, a level of 6.9, not 4.5, but 6.9 hospital beds per 1,000 people across the United States. That has collapsed since then. She says, in order to do this, look at the instances of the ability to do this today. The 1,000-bed Huoxinshan Hospital in Wuhan, in China, where the epidemic first hit, was built in 8 days, 1,000-bed hospital. In the United States, multiple field hospitals were built in record time last spring by the Army Corps of Engineers. All countries must work together to accomplish this, putting aside tensions and conflicts for the time being. She refers to the new strains of the COVID virus that are appearing, some of them showing the possibility not only to be still more infectious than anything that has appeared since, but even in the case of at least one that has appeared in India, the possibility to be defeating the vaccines, which are being very unevenly applied across the world. She says we're in a race against time. Our response to the pandemic, seen in these terms, is a question of existential importance to the human species. It requires the cooperation of all major industrialized nations. She then talks about the Committee for the Coincidence of Opposites, a committee formed at her initiative together with the initiative of Joycelyn Elders, the former Surgeon General of the United States. 2 pilot projects that committee has underway, embodying the principle of the coincidence of opposites. First, and she says these projects are undertaken in order to promote and provoke major government and institutional action. In Washington, D.C., in Ward 8, a team involving youth leaders is working to reach full COVID-19 vaccination and to initiate ongoing public health measures in this largely poor community. And in Africa, a committee shipment will arrive soon in Mozambique of combined medical, health, water, food, and seed supplies to make the point that both emergency and overall development measures are urgent at all points of need on the globe. The statement then describes in detail what is required for health security, what constitutes a modern health system that must be produced, built in every nation that does not now have one, in order to defeat this pandemic and future pandemics. First, hospital systems. Today's world total of 18.5 million beds, hospital beds, needs to be nearly doubled to some 35 million, along with the necessary staff and equipment for those hospitals, simply to meet the standard of the 70-year-old Hill-Burton Act of 4.5 beds per 1,000 residents. She says, as examples, that ratio is 0.7 per 1,000 residents in the entire category of what are called heavily indebted poor countries. For South Asia as a whole, the ratio is 0.7. In Nigeria, it is 0.5, and this is crucial. In India, it is 0.5. This means that there is one hospital bed on average for each 2,000 Indian citizens. Now, the positive test rate currently is averaging 20% of those tested are positive for COVID-19 in India. That means that of those 2,000 people for whom there is one hospital bed, 400 of them will test positive on average. Some 200 of them will become symptomatically ill, and between 30 and 50 of them will urgently require hospitalization. For them, there is one hospital bed. That gives you an idea. She talks about the necessity for a health corps, vast numbers of doctors, nurses, public health, and related staff, technicians, and she describes all the kind of staff that work in a hospital. Meeting this need demands the spectrum of training, ranging from many more teaching hospitals to thousands of youth training programs. Water and sanitation. One fully equipped hospital bed requires plumbing for at least 110 to 120 gallons of water per day. That means in the majority of these cases, fresh water supplies, a freshwater distribution system, and an associated sanitation and sewerage system must be new built wherever these hospitals are built. Electricity. A major hospital today requires on the order of 20 million kilowatt hours of electricity per year for all of its power requirements. These major hospitals are perhaps the most power dense or power intense infrastructure that there is in a modern economy, and they are targeted by the Green New Deal for that reason as examples of services, infrastructure services, which must be changed, must be cut back, must be relatively impoverished in order not to overheat the planet, because hospitals are very intense electricity users. Science and technology, there must be an expansion of both research, basic research, and development of technologies against diseases, and this must be done by in collaboration among major scientific and technological nations and others. We're reminded that the United Arab Emirates has just gone to Mars with an orbiter. There are many nations in which breakthroughs, new malaria drugs, many other kinds of breakthroughs are coming, which are not the big powers that you would think of. All of them must collaborate. And finally, Helga says, food is medicine. She's quoting there David Beasley, the director of the World Food Program. And it is necessary to double world food production in order to overcome the relatively disastrous drops in food production which have taken place due to pandemic illnesses among farm workers, due to border closures and all sorts of other restrictions. This has led to 9 million people dying of starvation in 2020, and according to David Beasley, the danger that 30 to 50 million more people will die of starvation in 2021 unless something drastic is done. In his case, what he requires is at least $5 billion of additional support from the WHO. However, the WHO distributes food, it doesn't grow it. It is necessary that world food production be doubled. And this involves the stimulation of high technology family farming all over the world and all the inputs that go with that. So this statement, Helga is directing, again, to the meeting, the world meeting of the World Health Organization in Rome, which begins a week from tomorrow. And this statement is in circulation as of tomorrow and is a demand and a proposal that that conference of the WHO should take up this call and call on all the nations of the world which have this capacity to collaborate in building, training, housing a modern health system and a modern public health screening, disease screening system in every country of the world. That is Helga's initiative reaching out to all of us and to all of you today.
Okay, so the idea would be that you would take that statement, and any of you who go to church or know anybody that does, you want to circulate these to relevant ministers, people in institutions, and also just people who are members. Ostensibly, there are 205 million Christians in the United States, 140 million of whom are Protestants, and the rest, I guess, Catholic or something else, I suppose, but I suppose that's what it is. So that means there's at least, 2 out of 3 people right there that ought to be able to take this and consider it. It's important to do this because it's 1 week before that conference. The issue is not whether or not the conference takes this up, which would be useful and we intend to have happen. We're trying to do something with persons that have some institutional standing within that locale. But the real idea is to, as we try to do around the Great Reset Conference, focus people on reversing the Malthusian commitment, which is actually what pollutes all proposed solutions of all variety that keep being proposed in many different forms to all problems presently facing the transatlantic sector. This doesn't mean that there's no one saying anything of sanity. That's not what I said. What I did say, and what I will repeat, is all solutions of an institutional variety presently being put forward on anything from military affairs to energy to food production to industrialization to financial reorganization and into investment. Anything being put forward is tainted by a Malthusian entropic outlook, an outlook which says you don't want to expand energy throughput, you don't want to expand population, you don't want to expand energy density, you don't want to expand consumption and expand production. What you want to do is cut all of these things back to fit into some Procrustean bed of death, which is what all of this will add to. And this is why there is no solution available. But that's not true. The solution, as was just outlined, is available. But what we want to do, what has to be done, is to break open the straitjacket of failed axioms that characterizes people both in this nation but in many other nations, actually in the transatlantic sector. The one thing I want to call attention to before we go back to Paul is that there was an extraordinary event on May 11th, which was called attention to by Helga Zepp LaRouche, and we're going to call attention to it now, and that was that the leader of the Nation of Islam, Minister Louis Farrakhan, on his 88th birthday, which was May 11th, premiered a earlier performance of the Beethoven Violin Concerto that he did, actually at the age of 68, back in 2002. And it was done as part of the celebration of the 250th birthday of Ludwig van Beethoven. The concert opened with a performance of the Fifth Symphony, and then Minister Louis Farrakhan performed on violin that violin concerto. Importantly, in his doing this, he was paying homage to not merely Beethoven, but to the person that had inspired him the most to play violin, well, his mother first, but then Yasha Haifet, the Russian, American, and also Jewish violinist that he had met as a young man of either 9 or 10. That would have been about 1943 or 44. I went backstage, met him, he got an autograph from him, and he, that is Minister Farrakhan, learned this piece in less than a year. It was considered by his violin teacher to be impossible for him to do it. He did it, and he performed it. It had not been premiered up to this time because there were been certain difficulties, technical difficulties, but more importantly, it came precisely as when it needed to come. And here's why it is important to state it to you, because it shocks everybody. Because Farrakhan is supposed to be a monster, just like Lyndon LaRouche was supposed to be a monster. Yet we know that the only, or one of the few, I should put it that way, it wasn't the only, but one of the few prominent Americans to say anything about Lyndon LaRouche at the time of his death, and to say some things about Lyndon LaRouche which were not only good but were exceptional, was Minister Louis Farrakhan, who had met LaRouche on a few occasions and with whom there had been a collaboration around an event called the Million Man March back in 1994-95. The event was in October of 1995, but the first meetings to discuss it involving at least Mr. LaRouche were held in March of 1994, and various of us were involved in that march intimately, particularly the Reverend James Bevel, myself, and a few others. So this is shocking. It's the sort of thing that will be rejected. It is not the case. Farrakhan is an anti-Semite. He's this, he's that, except when you hear him play the Beethoven, you know that can't be true. The reason this is significant is because his performance of Tuesday night is probably, as of now, the largest single classical music event in America since the time of COVID. There were 6,400 people that were watching live at the time, There were 40,000 people that have viewed it, at least as of sometime earlier today. And at least three-quarters of those people had never or would have never attended any form of classical music concert whatsoever. And most importantly, what he did was to single out various of the younger musicians for their participation in that occasion. This is the way that you roll back the so-called cancel culture. This is the way you fight the culture wars. You fight it by directly mastering something in the classical repertoire in this way, conveying the ideas of the classical repertoire directly in the medium that people tell you you can't, to the audiences of people that you are told can't understand it and don't want to understand it, and you take the highest idea directly to them, unfiltered. And that is exactly how we are to organize in the United States. That's what is meant by the Committee for the Coincidence of Opposites. It is an idea adapted from Cardinal Nicholas of Cusa. It's one of the most advanced and profound ideas in all of theology. And we are taking this idea, unvarnished, not dumbed down, not diluted, not even really explained, and we're demonstrating it by bringing people together that shouldn't be in the same room, whether that's a virtual room or a real room, and organizing to create a form of economic revolution, a kind of economic reconstruction, where we're saying no matter what you want to try to pretend, unless you take the whole world into account, you can't solve the problems that presently confront us. And that is the way, and the only way, that you will actually have the civilization survive the present crisis. Many things will be done as stopgap and Band-Aid and will seem to work, but they won't. And it's the strength to see that and to also just confront that by posing a solution that works. That's what we're all about. So this is a statement that we want you to take and deploy with this week, starting tomorrow. We start with the clergy because it's an obvious thing that everybody can do. You can find somebody. Then, of course, there are state legislators, other people, but that this point is basically made, particularly after today's announcement by Biden about everybody taking off their masks who's vaccinated, as though that were a solution to the actual circumstance confronting both the United States and the world as a whole. So we are in need of giving a certain kind of leadership, and what we're going to do now is go back to Paul, who has a presentation prepared to give you all an idea of what the battle situation is presently internationally, and then we'll go to the phones for questions, answers, and comments. So, Paul, we're back to you now.
Okay, thanks. Now, I'd like to say one additional thing about this statement that Helga is releasing tomorrow, and that is that the outlines of it, pretty much the entire outline that I just went through, in general is not a new release of ours. There is something qualitatively new there, but back on March 13th of 2020, at a very early point in this pandemic, we released a statement which simply said, urgent, the physical economic requirements for defeating COVID-19. And that statement, which was about 3 pages when it was printed in the EIR on the 20th, the issue of the 20th of March, that statement went through the same requirements for a modern health system in each country and said this had to be done to fight this pandemic. Now, we did not expect at that time, and I know Helga did not expect at that time, that this was going to be instantly or rapidly accomplished. This was rather something put on the agenda of what we were urging at that time, a summit, a prospective summit, either of the heads of state of the United States, Russia, China, and India, or, as President Putin had already proposed at that time, the heads of state of the 5 permanent members of the UN Security Council. That this was an item the most important item, perhaps, right along with the avoidance of global war, thermonuclear war. This had to be discussed by the leaders of those major powers as a task for the world, which they uniquely could take leadership of. But we did not expect that it would immediately get done. The qualitative difference now is the existence and fairly rapid growth now in the activity and the influence of the Committee for the Coincidence of Opposites, the initiative of Helga and Joycelyn Elders of last summer. This committee is now, as Helga's new statement says, it's now at the point where it has two model initiatives well underway. One demonstrating the way in which youth can be mobilized along with churches, along with others, in what is the poorest ward in Washington, D.C., to ensure universal vaccination or close enough to it to meet the standard of herd immunity, and to ensure that a functioning public health system of disease monitoring exists throughout that city. And the other, the model initiative, which is a model initiative for governments. Come on, you do this, which the Committee for the Coincidence of Opposites is carrying out to the aid of Mozambique. So that has changed the situation, and the urgency of the WHO being a venue and a launching point to get to that necessary summit at which this kind of infrastructure building can actually be planned so that it can begin. But to give you an idea, here is the report that the WHO itself just published yesterday called COVID-19, Make It the Last Pandemic. This is their report of, it's actually not of their board, but of an outside committee that they convened in order to study their work and how it could be improved. But it was aimed at this upcoming conference in Rome. Make It the Last Pandemic is the name of the report. The ex-Prime Minister of New Zealand and Ellen Johnson Sirleaf are the co-chairs of that independent panel. But in making their recommendations, how to make it the last pandemic, they talk about 1 billion doses of vaccine being given to COVAX no later than September this year, voluntary countries and manufacturers agreeing to license their technology and transfer it within 3 months, and the G7 countries to commit to about $12 billion of COVAX $19 billion budget. All worthy things to do. But then what do they exclude? They specifically exclude, as not in the scope of this recommendation, of their recommendation, domestic investments that primarily benefit a country's citizens, for example, building hospitals or training midwives, addressing endemic diseases such as malaria, HIV, TB, vaccine-preventable diseases, social and economic support and stimulus to help countries manage the impacts of COVID-19 and sustained response beyond the first 3 to 4 months. Those are excluded from their recommendations. So clearly, if all their recommendations are carried out to the letter, they would not make COVID-19 the last pandemic at all. And we must seriously look at the fact that the COVID-19 pandemic is now striking more people every day around the world than at any point since it began in December 19 or January 2020. More than at any point. And overwhelmingly, those people are being struck and are being struck down in the developing countries, India and Brazil, the two largest epicenters but the variants of the virus which are developing there are the next pandemic, in effect, for us, for the countries of Europe, and so on. That's where the next pandemic already lies. There are some well-publicized examples already in this country, well-publicized because they involve a major league ball team, the Yankees, where 7 or 8 fully vaccinated members of that ball club are positive for COVID, one of whom already had COVID and was fully vaccinated afterwards and is positive again. This is just an indication of what the staying power of this pandemic. This pandemic is the next pandemic. And it is not going to be prevented simply by vaccination on a mass scale worldwide against the virus as it was understood and as it was sequenced at various points last year or even now. It is only going to be defeated by the ability of every country to robustly and quickly treat people. When I mentioned before that the United States, under the impetus of the Hill-Burton Act, reached a point of in 1968 of 6.9 beds per hospital per 1,000 residents. It's now 2.7, but it was 6.9. And on the way to that peak came the flu pandemic of 1957, which was called at that time the Asian flu. And that was a very serious influenza pandemic, and in the United States, absolutely no mitigating measures were taken. None were even attempted. None were even discussed. People simply went about their lives, went about their businesses. The reason that pandemic claimed only half as many lives per capita in the United States as it did in the world as a whole was this extremely robust, at that time, extremely robust health care and hospital system and public health system. There were public health officers. The Surgeon General of the United States, Dr. Elder certainly understands this, the Surgeon General of the United States is in charge of the public health system of the United States, which is to monitor and prevent diseases from becoming pandemic or endemic. And that service has been allowed to wither tremendously at the same time as the number of hospitals has gone down to 2.7 on average per 1,000 in the United States. So this is a building program which is needed here as much as it is, not as much, is needed here as well as everywhere else. We've done it before, we have to do it again. But you could ask yourself, why did the WHO specifically exclude exactly what must be done from their recommendations to make this the last pandemic? Not because these are ill-intentioned people who did this report, but because this kind of thing simply is not being done. This raging pandemic has been discussed and discussed and discussed, and rules of every kind made for dealing with it without ever anyone, except for us, proposing, and now a broadened Schiller Institute and the Committee for the Coincidence of Offices. No one except for us has proposed to do this at all. So, or indicated a willingness. This takes credit. A lot of credit will have to be extended in order to do it. That has not been done throughout the entire pandemic. So here you have effectively this review committee of the WHO saying, oh, no, understand, we're not asking for hospitals to be built. We're not asking for domestic investments in building hospitals, training midwives, addressing endemic disease. No. We're asking for a worldwide vaccine mobilization. because their understanding, this committee's understanding, is that they could ask for it until they were blue in the face, and it would not happen. Now we have to be the instrumentality which changes that by really fighting now on the question of infrastructure. I'm just going to say a few things about what infrastructure actually is, and then end with that, and we can discuss what we have to do. There's publicity in addition to the Biden's brilliant remarks about masks today. He also had a meeting with a bunch of Republican senators in the White House, and afterwards they were all smiling cheerfully and saying they're making progress toward an agreement on an infrastructure bill. Now, the reason they're able to quite possibly make an agreement on this is not just the puny amount of investment which both parties are calling for into what they call infrastructure, $600 billion over 9 years in one case, roughly $700 billion over 9 years in the other case, and the Republicans magnanimously now saying, gee, we might go to $800 billion over 9 years in so-called infrastructure. So they're all in the same puny ballpark. That's one reason that they were being so bipartisan and cheerful. But the other characteristic is that none of what they're talking about is infrastructure at all. Infrastructure, and Lyndon LaRouche made quite a distinction between what most political hacks and so forth call infrastructure and what he called new economic platforms, sustaining a new kind of economic activity of an entire economy, an entire society. Those two things were quite different. That real infrastructure is an investment of technology, new technology usually, manpower, machinery, credit, in making something possible which simply has not been possible before. To give you a couple of ideas, the development of railroads in the United States and in Europe during the 19th century, they were developed because they met a certain need, which you might laugh at today, but was a very urgent need then, and that is for people to be able to travel during the winter. And in the 1860, traveling during the winter meant any time between roughly October and April. If you tried to travel any distance, you were taking a severe risk with your life. The railroads changed that. They also changed many other things having to do with freight, the ability of economic activity to be close for producers to be close to their markets, for economic activity and division of labor to exist in a productive way. But basically, first, they met a glaring need in a large country and large continents for people to be able to get anywhere in the winter, in a long 5 to 6 month period, which you might call winter. That was the reason, that was the transformation that railroads made. And transformations within that within that task are still going on. With the development of high-speed rail, with the development of maglev, still occurring. We proposed, and many times during the last half century, that the North American Water and Power Alliance project be revived from the 1960s, and that building on it should begin. The purpose of that North American water, or water from Alaska, as it was sometimes called, the purpose of that was not to just employ millions of people building tunnels and canals and pumps and so forth. It was to reverse the drought which is gradually desertifying the entire western half of North America, including the western 45% of the United States, which is desertifying in a long-term, gradually intensifying drought to the point where it is going to be next to impossible for people to live out there in any numbers. The idea of NWAPA was to meet the need to avert that and instead increase the population density capacity of the western part of North America and all the way from Canada down to Mexico, and to increase greatly the productivity of agriculture in particular in that area, such as had been done with one state, really, California, and that was all. Another example, which is perhaps the most famous in the world, the Tennessee Valley Authority, was not proposed because we needed to produce more power. There was power being produced, electric power being produced, including by large hydroelectric dams. This was already the thing in the 1920s, and dam builders were working all over the place. There were a lot of different public and private interests who already were looking at Muscle Shoals, Alabama, and saying that's a place where a lot of power could be produced, and the private companies wanted to monopolize it. Henry Ford wanted to get hold of it. But what Franklin Roosevelt's administration did with the Tennessee Valley Authority was something entirely different. It met the need to lift the majority of the population in the poorest, direst, poorest area of the entire country, to lift them up to the standards of productive economic life and activity and productive work, and to make electricity not just available, but available to the masses of the population who at that time primarily lived outside cities in rural areas, and therefore transformed their lives in terms of their productivity as farmers or workers, their children's education, their ability to study and to learn. All these things, that transformation is what TVA was aimed at and accomplished, and power came along with it. Those are examples of actual infrastructure where the TVA provided the model of how a river valley of a major river can be transformed by an all-around infrastructure which goes from flood management to water management for navigation to electric power to irrigation and education and the building of housing and the building of roads and railroads, all of these things, transforming a river valley in that way became a model for the entire world. Unfortunately, followed very, very seldom around the world. That's infrastructure. What we're talking about in Helga's statement that I went through at the beginning is the primary definition of the infrastructure which must be built in the world. And we have to go with it and demand it in that way. This, you can put aside all other infrastructural needs. You can let roads in the United States and bridges continue to crumble, if you will. But if you don't do this, if you don't build modern health system in every country, such as can cope with this kind of pandemic, then and with this kind of starvation and with this kind of disruption and collapse of agricultural production, if you don't do that, then you're condemning the population to the onslaught of the Malthusians, and their target includes, in the Green New Deal and in the Great Reset, their target includes hospital systems as a primary target, whose use of power has to be cut, and whose capacities for treating people in the process have to be cut. and you abandon the human race to that Malthusian policy and that Malthusian impulse to reduce the world's population if you don't do this infrastructure. So, again, that does not mean it can be done instantly or quickly. Things can be discussed about the difficulties of doing this. It must start with collusion, collaboration of at least some heads of state or committees which can influence heads of state in important countries. And that has got to, in turn, got to be launched from within the citizenry, where people are making clear to each other that this must be done. Forget whether it's called infrastructure or anything else. This must be done. This is a platform which the human race currently doesn't have and is in danger of dying, if not from war, then from disease and starvation, because it doesn't have this platform. At least the vast majority of the world doesn't have it, and has got to have it. So that's the import of Helga's call and indicates what we have to do with it.